Good afternoon. I would like to first thank Dr. Somasundaram sir, the Director of Public Health, Preventive Medicine and Public Health, and the entire team of organizing team of this conference for the kind invitation to speak here. Essentially, I will summarize our experience. I mean, when I say our, I mean the departments. The entire Department of Health and Family Welfare experience in carrying out evidence-based implementation research. Officially, we called it Operational Research Program. I will distinguish as we go along. In the last 4 years, there's been a pioneering effort by the government of Tamil Nadu, by the Department of Health. So the purpose is to illustrate with some specific examples from almost 30, actually to be precise, 31 studies commissioned by the Department, by the Tamil Nadu Health System Research Program, under which the Operation Research Program was initiated, 2021, exactly as we were going through the COVID. And the 31 studies, I will show you the link. You can leisurely go through what those studies are and what we have achieved. And given the limited time here, I would like to pick 3 studies from the very first round of this operational research from 2021. But before that, a few definitional issues. Okay? So all of us know that there is an overarching objective of the sector. As the theme of this conference says, building the resilience. Some people call it as strengthening the healthcare systems. The entire healthcare system, not just public healthcare, public system, but also the private. So what is it? I've always asked this question, and all of us should ask this question. Whatever be your position, I'm speaking as a researcher, we ask this question, as a researcher, what is it I can do that might contribute to the strengthening the healthcare system? As a researcher, as a public policy. And of course, it necessarily means engaging with the government. So engagement with the government is a must. Just as a farmer will have to get down to the field if he has to farm, if he has to cultivate. So that's the objective. And we'll begin with a very broad definition of 3 types of research. We are not going to speak about the biomedical research, but what we are going to talk may use and often would require knowledge of the biomedical system in building the healthcare delivery system. So, and then I will conclude with a couple of suggestions. I've given references for most of the slides. You can leisurely go through the full paper, but broadly this diagram shows you the distinction between three layers of research or types. The first is called operational research, second is implementation, third is health systems research. Inevitably, I mean, they're all linked, there is a lot of overlap. What we mean by operational research in one line is that you have already programs put in motion, in place, being rolled out. But as we all know, even well-designed, well-thought-out interventions will have context-specific operational challenges, which are somewhat different from implementation, but there is a lot, you can club most of the operational and implementation research into one category. But nonetheless, let me give an example. So, if you have, as I will show you, if you have a study that looks into the biomedical waste, liquid biomedical waste in district hospitals. So you take a sample of 5 or 6 hospitals and then you examine context-specific, hospital-specific challenges they face, meaning that the quantum, all options they have for reuse or discharge. So you will come with a specific list of challenges, and these are context specifics. So the study will end by highlighting, okay, in this particular institution, these are the challenges. In this particular institution, these are the things. At the same time, a cross-section of 5 or 6 institutions together may give some generic challenges as well. So this is just to illustrate what we mean by operational issues. A systemic one, how it can actually impact even the operation, could be, as the directorate or the ministry might be interested in deciding what is the total number of physicians we require or health workforce we require, maybe nursing. Now this requires thinking through layers of problems, but what you may arrive at eventually through this study, what is the total workforce we require next 10 years, could have a direct impact on the operational challenges you have in delivering services at even primary health care centers. If you underestimate, meaning that, instead of 1,000 or 2,000 population per physician, if you say could be 5,000, one physician per 5,000. So you are underestimating perhaps, and therefore it will have an impact on the recruitment and posting of the people, and therefore the workload on the physicians at the subcenters. So what you call as systems research will have a direct impact on, operationally speaking, at the subcenter or even primary healthcare center. So you can see a lot of overlap. And the implementation is also context specific, but even if you have sufficient money, even if you have sufficient manpower, problem is not solved. You may actually end up having a procedure or a delivery system that could result in quite a bit of redundancy or even wastage of resources. So we will illustrate as we go along. Therefore, what is written here from this manual that we prepared 4 years ago, which is also available on the website link that I will give you more detailed examples of the example I gave to distinguish 3 types of resources. There are more examples, and we are going to give more examples even today. So this guideline will give you, orient you to greater detail. So I will not read these things. I have already described what they are. So, in summary, I've given a summary, so let me not read the whole thing again. The key point is that these domains are not mutually exclusive, they overlap. Now, next few minutes that we have, what you see on the slide here is the brochure we prepared for the first 4 years. These brochures are available for you to read more carefully. The first page of this brochure gives you, for example, unfortunately the pointer is not working. Those of you can read. What it shows is the 5 or 6 themes on which we commissioned studies. We meaning the Government of Tamil Nadu through the TNHSRP ORP program. A study on patient safety, a study on biomedical waste, a study on antibiotic resistance, antibiotic prescriptions actually, a study on 108, study on Thai, and in the second year we commissioned 3 studies, in fact, all of which looked at the impact of COVID on TB care as well as ANC care, mental care, and so on. The following 2 years, again, we chose a few themes. These themes were chosen based on number of consultations with various directorates and their district level people. So it's not arbitrarily we sat in TNHSP office and chose what we thought we should do, but through consultation. So you have, if you look at the left-hand side, which is the brochure prepared for the last year, the 4th year, we have commissioned 6 studies, one of which on looking at the challenges in screening for non-communicable diseases among the those engaged in organized sectors. Then there is a study on TANQuest, a study on Lakshya. When I say study on Lakshya, what are the operational issues at the sub-center level or at taluk level or even district level in implementing Lakshya program, which is to improve the quality of care in the labor ward. And there is also a study we commissioned on Tamil Nadu Chief Minister's health insurance scheme. Okay, so more on this by taking a couple of examples. In view of time, I want to rush through this. So the slides are with the organizers. I'm sure they will circulate, and all the not only this PPT but the reports are all full-length reports are also there. Very quickly, the 3 studies, if time permits, at least 2 studies. This is all 3 from the first round, 2020-21. I deliberately choose these 3 from the conducted 4 years ago, and you can pick the same topic 4 years later. What is the status in your own region or district? Methodology is there, questionnaires are there. You have to deploy people to collect data. So it is. So what is the study? Is looked at the patient safety issues. To what extent we are being able to follow the national, the framework for national patient safety and in public health facilities in Tamil Nadu. So what you see here, don't try to read everything. I'll just highlight 1 or 2 points. It was carried out by ESIC team in Chennai. They took a sample of 6 district hospitals and they looked at the various parameters. The methodology is there in the full report in the link. But then they even interviewed close to 4,000, 5,000 patients in different departments across districts. Look at the look at the results and simple messages, recommendations. So they found on the ground, you may say that no, we have this committee, but what they found operationally is that there is an absence of the patient safety committee, lack of training even where they claimed it was there, okay? Lack of awareness among patients about patient safety measures, and so on, no periodic review. So what it came out with was, have a pakka, good patient safety committee that will ensure through periodic review that, wherever it needs to be tightened, patient safety in terms of fire, in terms of even water, in terms of sense of safety within the hospital, so on. This is very interesting. Prescription practice among physicians in district hospitals of antibiotics. And then again, the study by ESIC came out with the results. Look at the results. Okay, we have 3rd generation antibiotics, very highly used. Many of them were categorized as red categories by the WHO classification. So what they said is that we need a review of this. We don't have, nobody is questioning the physician's prescription practice. It is just first observation of what is being prescribed. Okay, prima facie, there is no way by which we can question. But prima facie, we can also say if there is a huge proportion of red category, let's do an audit. That's all. So it ended up with a very specific recommendation for having a stewardship committee that will do a periodic audit in different institutions on, and that might lead to further training programs and counseling and so on. Okay. So you can do one more study whether such a training program on prescription change the prescription practice, maybe after a few years. So those of you who are here can take up the same studies, look at your own hospital. Methodology is there and it's all, you can tweak. Of course, you can refine the methodology. Then I will give in 1 minute, a summary on the challenges that we face in implementing TIE. This was 4 years ago it was carried out. Many of you, most of us will be aware of the challenges we face. Have we overcome those challenges is something that I'm sure those of you sitting here will be able to reflect. This was done by Tirunelveli Medical College. Just look at the results and recommendation, not the other. So it was carried out in 4 different hospitals, Tengasi and Virudhunagar and Namaneri. What you find is that referrals of patients with head injury have increased due to non-availability of specialists. So this is a common problem, but then increasingly we should be able to demonstrate that we are overcoming that. So what efforts have been made to fill this gap in the last 4 years? You can go back to the same hospitals and do the study. Has things improved? And why, if it has improved, what has made that change possible, and why we are still stuck there? So, very simple message from the study which we can replicate. So, I am at the last slide. Okay, what we want to demonstrate, if you look at the original preamble of this program, the reason why this operational research was funded, nearly 2 crore per year, close to 7 crore was spent commissioning 31 studies. The 5th year is now going on. I am no longer the nodal person, but my colleague is the nodal person. What we would like to is to suggest is that this culture of doing operational research, call it implementation research, should be nurtured, and it takes time, encouraged. We don't need millions of rupees to do these operational studies. You're already there and you know the problems, but you have to formulate it as a research question and systematically collect the data and analyze, feed it back. These studies don't require approval. It's not a systemic, system level research requiring blessings from the highest authority and so on. With the money that you have, time you have, we can undertake these studies and tap into the existing database that we have, NSSO or HMIS, RCH and so on. Complement it with simple primary surveys as well. So with this comment and suggestion, I would like to close. I hope with the examples that I provided, the importance and the doability of operational research within the resources that we have is very important, wherever you are. And many of our colleagues from government have done studies which are part of this 31 studies I mentioned. So I hope this more and more people will undertake such studies in the years to come. That will definitely contribute to addressing the challenges that we have, that will strengthen the public healthcare system in Tamil Nadu. Thank you very much. Time? Oh, okay.
We thank you, sir, for your intellectual words. I invite our additional Director of Public Health Preventive Medicine, Dr. A. Sampath sir, onto the dais to felicitate Dr. Muraleedharan sir. Can we give a big hand of applause